Hi, I'm Dr. Elizabeth Zhang, and I am an ophthalmologist and oculoplastic surgeon. I just got home from work today and I had a patient ask a question, which I thought would make for a great short video. And this question was, when should people actually get eye exams? So, what I'm going to say now is completely my opinion. I don't think there's an exact right answer per se. I think if you ask different ophthalmologists and optometrists, you will hear different answers. So, this is just my take on it. So I think a first eye exam should actually be done on a child before the age of 5. There are some states that do require an eye exam before a patient can go to school. The comprehensiveness of this eye exam is, variable depending on which state you're in, but at least a vision should be checked. And the reason for this is because there's something called amblyopia. You may have heard of something called lazy eye. And basically, you have to learn how to see. And so if you take a child with a completely normal eye, you take a baby who would normally, everything is normal with their eye, and you sew their eyelids closed over their eye so that they can't see anything. And then at the age of 8, you unsew their eyelids. Well, this completely normal eye is going to be blind. The brain has to have these connections and wiring from interaction of the world for vision to actually develop in the brain and for that brain processing of vision to actually occur. So you generally want to find any kind of issues with the eye that might cause amblyopia before the age of 5, so that you actually have time by the age of 8 or 9 to actually correct any of those things. So that's my recommendation. At least it has to be something where someone's checking the actual eye vision, whether or not it has to be a full dilated eye exam. If I had a 5-year-old, I actually don't have any children, but if I had children, I would definitely do an eye exam on them before the age of 5 and make sure everything's good. I'd probably actually do it on them when they were like, really small babies, so that they can't really fight so hard. All right, so let's assume that you have normal 20/20 vision and you don't have any eye problems. So then how often do you need an eye exam? Well, in all honesty, you probably don't need an eye exam unless you're actually having some kind of vision problem. If your vision is perfect, and by perfect, we use kind of 20/20 as the standard, though actually the limit of human vision is 20/7. So the smaller that second number, the better the vision. So 2015 is better vision than 20/20, 20/30 is worse vision than 20/20. But if you don't need glasses, you're 20/20, you don't have any history of any kind of eye disease, you probably don't really need, routine regular eye exams. Now, if you have a benefit that allows you to do it, for example, um, your husband or wife or someone in your family needs glasses, so you buy vision insurance that covers everyone, and that vision insurance covers an annual eye exam, it's not a bad idea to get one. But do you absolutely need one? Well, as long as everything looks good, probably not. But if you do wear glasses or contact lenses, I would recommend, if you wear a soft contact lens, an exam every year. Just wearing soft contact lens puts you at risk for things like corneal ulcers and eye infections, and so you do want to get your eye checked every year. If you wear glasses, you can probably do every 2 to 3 years, and glasses don't really, even the prescription doesn't change. At least when I used to wear glasses, they get scratched up. It's probably a good idea to just, get a new pair of glasses every so often. And then if your pair of glasses breaks, then you can have a spare backup. If you are very nearsighted, then you're going to want to have eye exams a little bit more regularly, maybe every year, because if you're really nearsighted, the shape of your eye is really long, and so your retina may be a little thinner, and so you may be actually a little higher risk of a retinal tear, and so that would be a reason to just have that dilated eye exam. And when I say dilated, I mean when they put in the drops, that makes your pupils really large. And when you're young, it makes it so that you can't read for a few hours until that dilation wears off. When you're older, it's less problematic. So, and then as you get older, depending on what kind of family history you have, then you kind of have to have eye exams more often. So if you've got a positive family history of glaucoma, let's say you have a mother or father with glaucoma, if they develop glaucoma at the age of 60, then you should probably be getting regular eye exams by the time you are in your 50s or turn 50. So like maybe about 10 years younger than when they got diagnosed. Unless they got diagnosed late, then you want to, get your eye exams even earlier. Once you kind of get in your 60s, I tell my patients who are in their 60s, at that point, you really do want to get an annual eye exam. And the reason why is because as you get older, there are eye conditions that you want to find earlier than later. So I mentioned glaucoma. So glaucoma is something that can cause blindness. And when you lose vision from glaucoma, you can't get that vision back. But vision loss from glaucoma is very preventable. Glaucoma is very treatable. So you want to find glaucoma as early as possible. And so by doing annual eye exams, the dilated eye exams, I want to emphasize the dilated. Someone's got to be looking at your optic nerve and looking to see if there's any suspicion for glaucoma. And there is, doing the additional testing to see if you have glaucoma. Macular degeneration is actually called age-related macular degeneration. There's a reason why. As you get older, there's more chances of having it. And so again, once you're in your 60s, that's probably when I would start recommending doing a yearly eye exam. Cataracts also develop in anyone who lives old enough. Typically, by the time someone's in their 60s, they probably have some amount of cataract. That's another good reason to do an annual eye exam. So I hope that answers your question. Just to clarify a little bit more about dilation. So there are dilating drops, and that's what makes the pupil, which is the black circle in the center of your eye, large. And that makes it so that the ophthalmologist or optometrist can actually see to the back of the eye. And when we look in the back of the eye, we can look at the lens, we can look at the what's called vitreous, we can look at the retina, and we can look at the optic nerve. And so all of these things are important in order to actually do what's called a complete eye exam. Now, there are some places that may offer just getting a photo taken and looking at that photo, and that might not be a bad option. The photographs aren't 3D necessarily, but some photographs can actually catch, depending on the skill of the person who's doing your exam, they may actually catch something better on a photograph of your eye than actually examining you if they're not that great at doing an actual eye exam. But when you actually do an eye exam with a slit lamp, you actually get a 3D view. So you can actually see small elevations that you wouldn't see just on a 2D photograph. So the reason why people typically hate dilation is that it takes more time. So yes, it takes people between 15 and 30 minutes to actually get fully dilated. And some people even take more than 30 minutes. Some people unfortunately take like multiple drops in order to get dilated so that their pupil's large enough to see. And what happens is when your pupil's dilated, then the lens, so the way that you see both distance and near is the lens in your eye actually bends. And dilation actually suspends the muscle that allows your lens to bend. And so when you're young, you can see distance and near. And when you have the dilating drops, you can no longer see up close. And since most of our world is reading, either our phone or computers, it is a little annoying to not be able to do that for a few hours. As you get older, the lens gets less flexible, and so it can't bend as much. That's why people end up being in bifocals or progressives. And so dilation at that point has less effect on that near vision. It can still make your vision decrease a little bit, especially if you have a cataract. And it also will allow more light in, so you'll be more light sensitive, but it's not really as bad as when you were younger. And then if you've had cataract surgery, basically there's really not that much effect to the dilating drops other than more light coming into your eye. So I hope this video is helpful. If you found this information helpful, please subscribe to this YouTube channel. If you've got any questions that you'd like answered, you can leave that in the comments as well. Thank you.